Hello, I'm Violet Cairo, President of Rotary Club of Nairobi Muthaiga North. April is the Rotary International Month of Maternal and Child Health. What is the value of the life of one child saved? No one will ever know. But if the child were our own, the price tag would be marked not for sale. This life is invaluable. That was said by James L. Balmer Jr. in 1979 to 1980. Rotary makes high-quality healthcare available to vulnerable mothers and children so they may live longer and grow stronger. An estimated 5.9 million children under the age of 5 die annually due to malnutrition, inadequate healthcare, and poor sanitation, all of which can be prevented. Rotary provides education, immunization, birth kits, and mobile health clinics. Women are taught how to prevent mother-to-infant HIV transmission, how to breastfeed, and how to protect themselves and their children from disease. Rotary makes amazing things happen. For example, we have life-saving neonatal equipments which are given to hospitals. Our club, Rotary Club of Nairobi Muthaiga North, has a project that we call Mother and Child Health Phase 1 and 2. Those are the 2 projects that we've done so far. Our club has equipped several hospitals around Kenya, including Kiambu, Kisii, Makueni, and Narok counties. Mothers in labor are no longer turned away due to lack of life-saving equipment. I'll give an example. At the end of last year, we delivered equipment to several hospitals, and one of them was Matu Level 4 Hospital in Machakos. Our members had delivered the equipment, and part of the equipment were incubators. So once they left the hospital, a mother came in labor. And because the baby was not yet mature, it was a premature baby, the baby was put into this incubator. Now, if we had not delivered that equipment that afternoon, that baby would have been turned away, that mother would have been turned away with the baby and sent to look for another hospital that had the equipment. And it was so touching because as we were sitting having lunch, we received a photo of the baby in the incubator. That was a life saved. Another project is Healing Scars of War. In Poland, because the children have gone through so much war experiences, children have been traumatized by the war, and they now get a chance to be kids again at a Rotary camp with psychologists and art therapists. More than 100 children have benefited in the last 4 years because they go to this camp and they're able to play and have fun with fellow children. And in that process, they're able to talk about their experiences. Even when they start talking about the war experiences they've gone through, what happens is that at that precise moment, they shut down. But because they have other children who've experienced the same, they begin to now open up, and that leads to healing process. We also have sustainable programs. Rotary programs improves women's access to skilled health personnel, to doctors, nurses, midwives, or community health workers. Another area that has now emerged is what they call telemedicine. This is the use of information technology to provide healthcare from a distance, bringing doctors to patients virtually, enabling consultations between doctors worldwide. It is a chat via online video, allowing a physician to examine a patient remotely using a robot. This is happening in Nigeria, in Uganda, in DRC, and Zimbabwe. Another area is mobile prenatal clinics. Haiti has the highest maternal and infant mortality rate in the Western Hemisphere. Rotary provided a fully equipped medical jeep to volunteers and midwives to reach mothers and children in remote areas. We also have cancer screening. Rotarians provided mobile screening units and awareness training in Chennai, India, where there's a high mortality rate in women with breast and cervical cancer due to late diagnosis. We also have what they call preventing injuries and death projects. Rotarians launched a $3 million 5-year pilot to save lives of mothers and children during home deliveries in Nigeria. Since 2005, they have repaired 1,500 obstetric, fistula, restoring dignity and hope to vulnerable mothers. The provision of better maternal care, cancer screening services, healing from war, among other projects, ensure our mothers are safe and our children are provided for. This is the joy of being a Rotarian, as we are clearly working hard to ensure that the world's future remains bright.